So, with degenerative disc changes a normal part of aging, when is it time to get treated for those conditions? Let's talk about that, Dr. Patel.
Yeah, I think, it does, you sort of, we use that word degenerative, and yet we also say it's normal. And I think that's a sense that creates some tension or conflict as patients try to sort their way through this, right? Because degenerative in their mind, I think, in many people's minds means somehow a disease process, it's progressive, it's irreversible. And I think a lot of patients have stories, themselves, their family members, their friends, who have suffered from lower back or from chronic neck pain issues, chronic lower back pain issues, and have been given that diagnosis of degenerative disc disease, right? So to answer your question, when do you seek treatment? It's probably more symptom-driven treatment as opposed to a firm diagnosis, right? As Tom mentioned, you may have degenerative disc disease in your neck, you may have degenerative disc disease in your lower back, and have very little to no symptoms for it, in which case less is more. You need less treatment. You need to be encouraged to live your life, be active. But I think as soon as somebody's developing symptoms, we try to intervene. I'd be curious from the group what your most common interventions are. My most common conversation with patients after spending a lot of time counseling them that these are normal things to go through. I feel bad they're going through it, but it's normal. Then the conversations oftentimes come down to, what's your diet look like? What's your exercise look like? Are you willing to stop smoking, right? Because there are things that you can control.
Yeah.
And then there are things, aging, genetics, family history, that you can't control. So I try to focus on the things you can control.
Right. Yeah, that's amazing. How long should patients go with pain? Do you just put up with the pain, or, you take over the counter medications, you go see a chiropractor or a massage therapist? If you've got pain going on, how long should that last before you might need further treatment? Who would like to tackle that?
I can take that. I can try to. It depends on what type of pain we're talking about. And neck pain is very different than arm pain. That's oftentimes different than pain that comes over the shoulder blade region and the trapezial region. But if we're just talking about axial neck pain, which is dead center in your neck, it's worse with mechanical activity, sometimes better when you wake up, and throughout the day it starts to get worse, sort of like a shoulder or a knee or a hip. That is typically arthritic type of pain. And the majority of human beings do not, even though they have arthritis or degenerative changes on their x-rays or the MRI, they don't develop chronic neck pain. The majority of people will at some point in their life have an episode of neck pain, but typically it will get better. But if we're just talking about neck pain, then I think, as Alpesh appropriately discussed, healthy diet, lots of physical therapy, and activity on a daily basis. And I said lots of physical therapy. If they're not getting better, then I'll send them to a course of physical therapy. But patients can't go to physical therapy forever. And it really is based upon an incorporation of the exercises that one learns in physical therapy and does it daily. I'm a big proponent of the merits of exercise on a daily basis, eating right. And as physicians, I think there's a lot that we can do to make sure that we harmonize our approach with what's happening in the rest of the medical record, with our internal medicine folks, what's happening in the labs, because it's all interrelated. So we try to take a comprehensive approach, and that's why, most spine programs across the country have a large contingent of medical spine specialists, in addition to colleagues that treat the internal medicine issues. But comprehensively, I think addressing an episode of neck pain or a chronicity of neck pain in a very holistic manner is the right way to do. But usually it's not a chronic issue. Now, we talk about arm pain, it's a very different story. There are different echelons of care that we send the patient down to. It's probably a separate question, so I'll stop there and we'll just leave it at neck.